In this video, we will explore arrhythmogenic right ventricular cardiomyopathy, ARVC, a rare hereditary cardiac condition associated with ventricular arrhythmias and sudden cardiac death. We will cover its genetic basis, clinical manifestations, diagnostic criteria, imaging modalities, risk stratification, treatment options, and genetic counseling. Let's get started. Arrhythmogenic right ventricular cardiomyopathy, ARVC, is caused by mutations in desmosomal proteins that maintain cell adhesion in the heart. This disrupts normal heart function, leading to electrical problems and increased risk of arrhythmias. Accurate diagnosis and targeted treatments rely on understanding these genetic abnormalities. The clinical manifestations of ARVC are diverse, encompassing a wide range of cardiac abnormalities. Historically, ARVC was primarily recognized as an arrhythmogenic disorder due to its propensity for ventricular arrhythmias, including ventricular tachycardia, ventricular fibrillation, and sudden cardiac death. However, as our knowledge of the disease has advanced, it has become evident that ARVC also encompasses a cardiomyopathic component, leading to progressive right ventricular dysfunction and heart failure. Patients may present with palpitations, dizziness, syncope, heart murmurs, and signs of right-sided heart failure, such as edema and hepatomegaly. Timely recognition of these clinical manifestations is crucial for early diagnosis and appropriate management of ARVC patients. Accurate diagnosis of ARVC is difficult due to its varied presentation and lack of definitive tests. Diagnostic criteria, such as the ESCAPE and international criteria, consider clinical features, ECG, imaging, arrhythmias, tissue characterization, and family history to differentiate ARVC from other conditions. Cardiac MRI is critical for detecting and managing ARVC. It allows visualization of structural abnormalities, such as ventricular dilation and wall motion issues, as well as myocardial fibrofatty infiltration. It also helps assess ventricular function, scar burden, and risk stratification. Serial MRIs enable monitoring and early complication detection. Right ventricular angiography is an important tool for evaluating structural abnormalities in ARVC. It involves injecting dye into the right ventricle to visualize its anatomy, wall motion, aneurysms, and wall thinning. However, it is now reserved for specific cases due to its invasive nature and the availability of non-invasive imaging methods like cardiac MRI. Genetic testing is a game changer in cardiology, helping doctors identify specific gene mutations causing inherited heart diseases like ARVC. It uncovers the molecular reasons behind the disease, allows for precise diagnosis, assesses the risk, and guides treatment decisions. Advanced sequencing techniques can test many genes related to ARVC at once. Finding a problematic variant in genes like PKP2, DSP, or DSG2 confirms an ARVC diagnosis when other clinical criteria are absent. It's also essential for screening family members, systemically testing relatives to detect those at risk and plan ahead for their treatment. Risk stratification is necessary to identify ARVC patients at high risk of ventricular arrhythmias and sudden cardiac death, SCD. Factors like genetic mutations, family history of SCD, and imaging help assess individual risk. ICDs and medication may be used in high-risk patients. Implantable cardioverter defibrillators, ICDs, have revolutionized the management of ventricular arrhythmias and the prevention of sudden cardiac death, SCD, in patients with ARVC. These devices continuously monitor the heart's electrical activity and deliver a high-energy shock to terminate life-threatening ventricular arrhythmias. ICD implantation is recommended in ARVC patients who have experienced sustained ventricular tachycardia, aborted SCD, or exhibit high-risk features on risk stratification. ICD therapy not only provides a means of preventing SCD but also offers valuable diagnostic information through the stored electrograms, facilitating subsequent management decisions. However, ICD implantation should be individualized, considering patient preferences, potential complications, and lifestyle modifications associated with device therapy. In ARVC, heart failure arises due to heart muscle dysfunction. Medications like beta blockers, ACE inhibitors, ARBs, and mineralocorticoid receptor antagonists form the foundation of treatment, improving symptoms and prolonging survival. CRT may be used in severe cases. Individualized management is important. In ARVC, exercise recommendations vary due to the risk of arrhythmias. Competitive sports are discouraged, but moderate exercise is beneficial. Individualized plans should be made with cardiologists and exercise specialists, considering clinical status, arrhythmias, and preferences. Regular monitoring is essential for safety. Shared decision-making is crucial. In severe cases of end-stage heart failure refractory to medical therapy, cardiac transplantation remains a vital treatment option for ARVC patients. Cardiac transplantation offers the potential for significant improvement in quality of life and survival. However, careful patient selection and meticulous post-transplant management are crucial for optimal outcomes. ARVC patients may present unique challenges, including the risk of recurrent disease in the allograft, ventricular arrhythmias, and the need for close monitoring and therapy adjustment. Multidisciplinary collaboration between cardiologists, transplant surgeons, electrophysiologists, and genetic counselors is paramount in the evaluation, selection, and long-term management of ARVC patients undergoing cardiac transplantation. Genetic counseling in ARVC is crucial for patients and families. The disease has an autosomal dominant inheritance. Counselors educate on testing, risk assessment, and prevention. Discussions include family planning, prenatal testing, and psychological impact. This empowers informed decisions for optimal management and well-being. In conclusion, arrhythmogenic right ventricular cardiomyopathy, ARVC, is a complex cardiac disorder. This video has provided in-depth information on its genetic basis, clinical manifestations, diagnosis, imaging, treatment, and genetic counseling. This knowledge will help us provide optimal care to ARVC patients in our future medical practice.